Thank you so much, Lars. And again, thank you all as we transition to this next session. I think you'll be very excited to hear more about this topic. And just for information, the presenters' bios are also in the packet, but let me give you a brief overview, and you will see we have quite a lineup of national experts. First, we have Mark Holmes, who is the professor in the Department of the Health Policy and Management at the University of North Carolina, Gilling School of Global Public Health, and director of the Cecil G. Shep Center for Health Services Research. He's also the director of the North Carolina Rural Health Research and Policy Analysis Center and the co-director of the Program on Healthcare Economics and Finance. His interests include hospital finance, rural health, workforce, health policy, and patient-centered outcomes research. Our next speaker comes to us from Alaska. Her name is Valerie Davidson, and she is a Yupik, an enrolled tribal member of the Ortsumnuit Traditional Native Council of Bethel, and I'm going to have her pronounce that correctly for you when she speaks. She also serves as the president of the Alaska Pacific University as its first female president. Davidson's 20-year healthcare career has included state service as commissioner of the Alaska Department of Health and Social Services, where she implemented Medicaid expansion, Medicaid reform, and Alaska Tribal Child Welfare Compact. She also served as Alaska's first Alaska Native female lieutenant governor in the final weeks of the Walker administration. Our next speaker is Sirin Yamnirsieri, and she is a senior statistician at the U.S. Government Accountability Office. Previously, she was a health statistician at the National Center for Health Statistics at the Centers for Disease Control and Prevention, where she provided data expertise to Healthy People 2020. In addition to rural health, her areas of interest include vital statistics, health disparities, developing key indicators, assessing data quality, statistics, and data visualization. Our next speaker will be a member of our planning committee, Alva Ferdinand. She is an assistant professor with the Department of Health and Policy Management at the Texas A&M School of Public Health. She serves as the director of the Southwest Rural Health Research Center at the School of Public Health, and her interest areas of research include health laws, ethics, disparities in health outcomes, research integrity, state and federal regulation in healthcare delivery, and effectiveness at laws aimed at improving public health. And finally, we hear from Dr. Jan Eberich at the University of South Carolina. She is an assistant professor of epidemiology and is the director of the Rural and Minority Health Research Center at the University of South Carolina. She conducts research in the areas of health geography, social epidemiology, and cancer prevention and control. As director of the Rural and Minority Health Research Center at the Arnold School of Public Health, she works with investigators across the university to identify and address problems experienced by rural and minority populations in order to guide research, policy, and related advocacy. So with this, I'll turn it over to Mark.